Hello and thank you for joining this OncLive Peer Exchange, Therapeutic Strategies in Metastatic Colorectal Cancer. Management of advanced colorectal cancer ideally involves a multidisciplinary approach and an understanding of the benefits and limitations associated with the available options. The rapidly evolving treatment landscape has both improved survival but also brought new questions to light in terms of biomarkers and optimal sequencing. Today, we will discuss strategies and approaches to managing metastatic colorectal cancer, including the latest research and how it may influence clinical practice today. My name is Dr. John Marshall, and I'm a professor and chief of the Division of Hematology and Oncology at Georgetown University Hospital, and play a bunch of other roles there, including Associate Director of Clinical Research, and if anything's going wrong, it's my fault. So I'm really glad to be here today, where I'm joined by some fabulous friends and world experts in the area of metastatic colorectal cancer. And let me first introduce down to my left, Dr. Tanios Bekaii-Saab, who is the Section Chief of GI Oncology at I'm going to take it from you, the Ohio State University James Cancer Center. Next to me on this side, Dr. Johanna Bendell, Director of GI Oncology Research and Associate Director of Drug Development Unit at the Sarah Cannon Research Institute, now a global cancer center. Wow. Johanna, thanks very much for coming. Next to me, too, Dr. Charlie Fuchs, also a fabulous friend over the years. We're getting old, young man, of the Dana-Farber Cancer Institute, and also a professor of medicine at Harvard, and Dr. Richard Kim, who is a medical oncologist at the GI Oncology Department and an associate professor in the Department of Internal Medicine in the warmest place in the country right now, the Moffitt Cancer Center down in Tampa. So thank you guys all for joining us today. We've got a lot to cover, so let's just dive right in. And Richard, I'm going to start with you. I think, you know, we all recognize that metastatic colorectal cancer is a team sport. It requires interventional radiology, surgery, GI, and decision-making about that. I happen to have been pleased to come visit your center once and attended a tumor board there, or your multi-D GI conference, and maybe talk a little bit about how you think we should take care of these patients from a multidisciplinary approach.
Sure. So I think in the past, the stage 4 colon cancer, patients 10 years ago were just treated with chemotherapy. But now I think times have changed with their new development, more data coming out saying that if you have oligomets to liver, lung, you could potentially be cured. So some of the patients that we see in our clinics get presented in our multi-D clinic, multi-D tumor board. And in the multi-D tumor board, we have specialists from interventional radiologists, we have our surgeons, we have radiation oncologists, and we have pathologists to help us to make that decision. And it's very important because even though patient may have a stage 4 disease, in isolated to liver and lung, those patients could be cured. So we want to sequence them in the right way. Do we give chemo first? Do we give surgery up front? Do we give radiation up front? So those are the sequence the decisions that we make at our tumor board so that we could give the best care for the patient.
You know, you guys, I was incredibly impressed. I came back and said, we have to do it this way at our place. You presented, I think, every case for the week, and you had your practice guidelines on one wall, you had pathology and radiology on another wall, and you made sort of rapid fire decisions. You know, how, in the Mecca of Harvard, how's it done there when you see a patient for
Probably not as well as it's done in Florida, but no, it really does require a multidisciplinary team. And in fact, I would say it's often more than one surgeon in these cases. It'll be a thoracic surgeon, a surgeon who does hepatic resections, as well as the colorectal surgeon, because they're so specialized. You can't always get them all in the same room, but you have to engage in a conversation that includes the multiple surgeons, the interventional radiologists, because we're moving the bar on who can we resect for cure in metastatic disease. It's really exciting, but it requires a lot of players.
Yeah, no, so we kind of have it lucky. We just walk down the hall and we run into our multidisciplinary team. I worry about the guys who are providing community oncology, where they have to sort of duct tape together this team. I know, you know, you guys out, we do a lot of community practice, but maybe Johanna, any advice to those guys out there and gals who are trying to pull together this kind of advice for patients?
Well, certainly the multidisciplinary conference also exists in the community, and we have conferences that happen once a week where we go over the different cases with all the different specialties. And for those of you in the community, you all know that we use our cell phones a lot, and a lot of it is calling from one place to the other and making sure that we can get the radiology to the surgeons or to the radiation oncologists so everybody can take a look together. But we do our own, a little bit more duct tape together form of the multidisciplinary approach.